something that I learned to do, I guess, seeing presentations, acknowledging the territory that we're on. So I think it's important to acknowledge that we are on Mohawk territory. And the reason why I'm taking the time just to say that is not only because I think it's important to mention it, but also because it's not something that I'm used to doing, because I'm non-Aboriginal and because we're not used to thinking that way. And also because, and I hope you'll see it through the presentation, it reminds me of our role as researchers or as clinicians, as outsiders, one of which I believe very strongly is to recognize, to observe, but also to disseminate. And so that's what I'm doing right now. So my name is Sarah, and I'm a professor at University of Montreal in psychoeducation. I'm a psychologist by training, and I did my training in transcultural psychology, as well as, so it's both in Aboriginal communities, but also with immigrants and refugees and asylum seekers. And the research that I've done, so through the PhD and then postdoc and now, has really been in the north. So I'll be telling you a little bit about Nunavik. And as Arlene said, she feels that she's more, you work more with First Nations. I think at a long time ago, well, not that long ago, but I would have said that I'm a specialist, or, you know, what is your expertise? It would be Aboriginal health. Now more and more I'm realizing that I know nothing about Aboriginal health, but I'm really working in Nunavik, and I have no expertise, but I'm trying the best I can, and I'm going to share that with you. So other than that, I'm both a clinician and a researcher. So that's why my interests are, you're going to see, are probably linked to mental health, to well-being, both in the intervention level and the research. So I hope that this presentation can be a mix of research, but that I think it's as beneficial for researchers and for clinicians. And I'm pretty sure that it's basically going to be, I hope that you are all going to say, well, we know this, but that it's in terms that you might not have thought about before. Okay, so hopefully we'll refer to other things that you can read after and then say, okay, this helps me understand better our experiences. So the reason why I asked Arlene to speak first was because she really covered the whole empowerment concept. And I would like to show how we tried, and we're trying very hard to integrate the empowerment within our project. But sometimes it's not easy to do. And what I wanted to do is to start with just a tad of theory. So it's basically like what we started off when we started this project about 3-4 years ago. Then I'm going to explain a bit the project, our experience, and then we're going to go back to theory to kind of link the experience with theory, but you'll see it's going to be back and forth. The reason why I want to do this is that when we talk about action research, when we read about action research, I'm sure that most of you have read already action research, capacity building, empowerment. The principles are really, really neat. They're very interesting, and it just makes sense. And then when I started working on the ground, I was thinking, I'm either a horrible researcher and not able to find the relevant papers that I should be reading, or I'm a horrible community mobilization person because there's so many obstacles. And so is it just happening to me, or is this something that's common? And so if we look at action research, I know that you guys had a day on Monday that must have been very, very interesting with Anne McCauley. You all were here on Monday? No, not everyone, unfortunately. Okay, well, they spent the whole day talking about community-based participatory research. And so in 2 slides, action research is a group of methodologies that requires participation between multiple stakeholders, and it's oriented, as Arlene was saying, towards social justice, reduction of social inequalities, and it's towards empowerment and action. So those are really like the values, as Arlene was saying again, was the values that you're going to incarnate at every single step of whatever process you're going to take. So no matter what methodology you're going to be using, it's going to be through these values, this set of core values. It exists. You'll build on existing resources at the local level, and you strengthen the strengths that are already present at the local level. There's many articles, and I think a couple of them might have been in your course pack, on community-based participatory research, which is a component or part of action research, or a type of action research. And you look at the different principles that have been, there are multiple, and I just took out a few here. But you want to, as we said, include multiple stakeholders, recognize the uniqueness and strength of all partners, develop trust, collaboration, shared decisions, achieving balance between results and research, results for the community and research, and work around capacity building, systems development, empowerment, and sustainability. So a lot of principles that you always keep in mind. These I put them here. I don't want to go through them, but I put them for yourself. If ever you have to write up a grant or write articles or look at, prove, like for example, you were asking the question of what methods you're going to use. Well, no matter what methods you're going to use, you want to make sure that you have these criteria for trustworthiness. So when we talk in quantitative terms, we'll talk about validity, so external or internal validity. But if you work in qualitative methodologies and community-based participatory research, you can use these criteria to help guide the work that you're going to be doing. And if we have time later, what we could do is actually just go through them again and see, do you think that with the project that we are trying to put in place now, we were able to apply these criteria? So credibility, fairness, ontological authenticity, educative authenticity, catalytic authenticity, and tactical authenticity. The ones that you might be less familiar with. So it's the idea that we're going to be recognizing that everyone has differences, but we're also going to be ensuring that through the processes, the different people that are there are going to be able to learn from the others' experiences and change their own experiences, and then through those changes act with what they believe in. Another notion that we often talk of, and that's very, very closely related to action research, is capacity building. So very often we're going to say that action research, or that, for example, empowerment research, is going to build capacity. And in the past decade at least, there's been a bit of criticism with regards to these words, because empowerment, capacity building, action research are words that are easy to use, but that are difficult to actually implement. And so some people will say, that's nothing. Like, what is capacity building? So in theory, we can define it. When you arrive to practice it, sometimes it's a lot more complex. And then one of the very, very difficult things is that when we use these words, because the intention is so good, sometimes it's very hard to see the negative impact that it could potentially be having as well. So that's the angle that I'm kind of going to be using for today. In capacity building, there's multiple models that can be used, one of which is these 9 spheres of capacity building. So participation, leadership, community structures, links with the outside, ability to ask why, ability to obtain resources, developing knowledge, capacity learning, social linking, feelings of belonging. Okay, so those are different spheres that you can, if we're talking about evaluation, you're going to start with all of these different spheres and say, okay, well, where are we at on these spheres before a program is implemented and after a program is implemented, using different methods. The before last concept that I wanted to just introduce very briefly, and so you've already heard of, was empowerment. There's so many ways of describing empowerment and power. I mean, there's different conceptualizations of power. So in sociology and anthropology, they're going to understand there are different authors that will have described power in different ways. So we think of Foucault, for example, Giddens, and Nietzsche. So they're going to all have their different understanding of power. But Nelson has a very interesting paper that kind of brings all of the conceptualizations of power and empowerment together and says, well, it's pretty much 3 basic components. Perceived and actual power, so it's not just what's happening, but it's how you feel that it's happening. It's having the possibility to place the self in community, which I find very, very interesting, because it's this idea of, well, like you said, there's empowerment at the individual level, but for it to be really functional, you have to make sure that the individual is part of something else. So there's notion of belonging that we're going to come back to later on. And so it's being part of a collective body and having a choice to control and guide the collective body. And finally, includes access to valued resources. And I really, really appreciate Giddens' work. I don't know if any of you are familiar with interactionism structuration theory. You might know more than I, so if you want to talk about it, wonderful. But what I find really interesting about Giddens is that he understands power as something that's at the same time within an individual. So an individual will have a certain agency, but it's also very, very much influenced by social structures that we're part of. And so these, in interactionism, we're going to say that, for example, institutions or systems they have a certain culture, they have values and organization, and that through our micro interactions at a day-to-day level, we replicate those values because of our status, because of the context that we're in. And so by our micro interactions, for example, me being here today and talking to you, that's taking place because I have a job at the University of Montreal, and it gives me a certain status that allows people to think that what I'm going to say to you is true. So that we're replicating this dynamic of universities, okay? So what Giddens would suggest is that at the same time, I can create change, I can, as an individual, do something, but it will be very circumscribed by the environment that we're in. And it requires a certain amount of resources and abilities, so different experiences, to be able to enact the power that we do have. And that power is a process. So as Arlene was saying, it's something that changes over time, that takes a lot of time. And the final concept that I wanted to bring forward before we start is this idea of community mobilization and planning. So has anyone worked in community mobilization? Have you guys read like the steps to how to start a project? Yes, a couple of people. When there's all these wonderful guides of what to do, and then you feel like you're mastering the guide and you know exactly what you have to be doing. This is what we were talking about with Kim, is that, you know, the idea is that, community mobilization is a process through which local individuals, groups, or organizations identify needs, plan, carry out, and evaluation activities on a participatory and ongoing basis to improve their lives. So there's these different steps that you have to, what are my needs? You'll develop a clear, from your needs, you'll develop a clear vision of where you want to move forward. Then from the visions, you're going to determine goals. So ideally SMART goals that you can measure and evaluate. Then you're going to elaborate the action plan, assess, ensure that there's a clear governance of who's going to do what. And then you're going to, this is not always written in the guides, but you really need to do, is develop conflict management process, because there's a couple of very interesting articles on public health and community development that suggest that if you don't have the conflict management process really panned out, it's not going to work, because you need conflict and you need to resolve the conflict. And if you pretend there's no conflict, or if you don't resolve the conflict, it's going to break. So these are very, I think if we look step by step, what we did last year is, I'll show you in a few slides, but you sit around together, think through, have this reflexive process of determining where you can see yourself in the future. What do you want? What do you need to get there? What are the small short-term goals? And then who's going to do what? And then it's going to work. So I'm going to speak to you a little bit about a project that we've been working on for the past few years. For sake of anonymity, because it's also being recorded, I'm not going to be discussing the community per se, although there's very much important stuff to know about the community context. But I will, you all know that it's going to be it's in Nunavik. This is a horrible map. But if you can see something, this is Quebec, and this is Nunavik. Montreal is down here, and you have Quebec over here, and Nunavik is, I think, a third of the region of the whole province of Quebec. Nunavik has a total of 14 communities that are distributed on both two coasts. There's one community that shares land with the Cree, and the rest of the communities are all Inuit communities, and they have to fly from one community to the other to be able to be in contact. There's a couple of communities where you could skidoo, or you could dog sled or walk, but they're very adventurous when they do that. So the way that this project started is that about 4 years ago, we received a very small planning grant. And the idea was to develop with this grant an advisory board for a project that flopped. So we went to see people that were at the higher level in Nunavik to say, well, we have the money available. We would like to help in any project that you have at the community level. So if there's something that's happening in a community, could we be of any use to the community with this money? And luckily for us, and I guess they might say to themselves, they feel happy as well, I hope. But we ended up in a very interesting partnership around this project that was just starting, basically. So basically what was happening is that there's an organization called, or not an organization, it's a committee called the Regional Partnership Committee of Nunavik that had organized in about 2007 or a little bit before. And their main goal was to reduce the placements under youth protection. Because in 2007, 2010, there were two reports that were under the Commission of the Rights of the Child that were showing just disastrous number of singlements and placements under youth protection. So in a given time, there was about a third of Inuit children that were being signaled. Children could be signaled 6 times or more. There were really few evaluations of the context of the children or of their needs, and they were not always, obviously, but when they were being placed, it was very difficult to find placements, and there was no services or very little services that were available for certain groups. So, for example, mental health issues, everything that's behavioral issues, there's very little that was in place to be able to help. So what we were seeing, and that what we continue seeing through the interviews that we were doing, is that some families will take children in foster care, but will not necessarily be getting any support or resources to help those children. And then they just get extenuated and say, well, we can't do it anymore. And the child ends up moving constantly. And there's a lot of out-of-community placements. So the procedures are complex, but they always try to have the children stay within the community, which is not always possible. And when they can't stay within the community, they might be sent to another community where a family would be available. And if, again, that is not possible, then they'll be sent out of Nunavik. So you can have children who are placed in the south or in residences, for example. So that does happen. But it's definitely not what social services tries to do. They try as much as possible to keep the children within the communities. So the Regional Partnership Committee said, okay, we have this huge problem. We have to try and find solutions, new solutions to resolve the issue. And so let's try and work together with one pilot community that will start off this project. And if it works well, and if the evaluation or the research team is able to document the whole process, then we might be able to get funds elsewhere and do this same process in other communities, okay? So this is just, I really won't go into details, but a brief understanding of the context within which we are. And I think it's important because we were talking about the current oppression. I think it's just the current context within which people are living today and how it's influencing the development of new solutions. So you all heard about the Indian Act, I hope, this week, and you alluded upon it today. In the Indian Act, Inuit are not mentioned. So we'll talk about Indians, and Inuit are not considered Indians, and therefore are not we're not legally necessarily under the jurisdiction of the federal government. And so it becomes very, very complex because who is responsible for ensuring the care of Inuit people? And so in the 1970s, or a little bit before that, the Quebec government realized all the hydroelectric possibilities in the north and said, wonderful, we're going up there and we're going to use the hydro resources. However, the Cree were not too appreciative of that, and they said, we're going to negotiate something here. And so the Cree started a negotiation, which the Inuit decided to take part in and to have their own negotiation process, which they're currently interviewing all the people who were part of this negotiation process, and they're going to make a documentary very soon. So if you guys imagine, very different from most Aboriginal communities where there's been contact with non-Aboriginal people for centuries, in the north, there's very, very little contact with non-Aboriginal people until the 1940s, 50s. And so it's in the 1970s that this agreement takes place, and it's a legal contract. Like I find it quite amazing. It's only been a few years that we know non-Aboriginal people, law and all that is definitely not, in their background, or like the Canadian law. And you have young men, 20 to 30 years old, who are able to write out this really intense, elaborate James Bay Agreement. It's a James Bay and Northern Quebec Agreement. In this agreement, there's 2 major things that come out. There's one, we're going to ask, so the Quebec government is going to be responsible for the majority, about 80% of our health, education, social services, and just like you have the Kativik regional government that is responsible for daycares and for a lot of just the municipality level governance. And so they all have governing boards that are constituted of Inuit people. You should never say Inuit people because Inuit means people. It's okay. We make errors. But they are under the legislation, the Quebec provincial legislation. So if you want a pocket of money for something, you have to request with these very elaborate paperwork things that I'll never be able to understand. You send them out, you ask for permission to get a certain amount of money for a certain activity, and then it's granted or not granted, and then you have a certain number of years to use that money. And then on the other side, what they received was a pocket of money for social development of the North, and they use the money to develop what's called Makivik Corporation. And Makivik Corporation is very, very interesting. Its mandate is mostly the economic, but it's become more of a social, as well, social development of the North. And it has, again, an Inuit board that is elected by the people of Nunavik. And you have, what they tried to do, or in about not even 10 years ago, was have this regional partnership committee that would regroup directors, representatives of all of these organizations and all kinds of community-based organizations as well as Makivik, to say, well, we have pockets of money that are coming from everywhere. How can we make that money come together and have regional level priorities? And so they meet about 3-4 times a year, and they developed 3 major projects. One is having local core agents, so it's a representative at local levels of the Regional Partnership Committee. And then so at the local level, what they do is that they replicate the Regional Partnership Committee. They go get one representative of every single service within the community, and they have meetings once a month. And then they have a project on social regulation that's really about changing how law is articulated and experienced within the communities. And they have what we've called the Inuit project, which is the project that I'll be talking about today. And then we have these people who are outsiders who are part of the project. So we have researchers, some health professionals, and NGOs. In a context like this, all of us here would be somewhere here. What could be our role? When you think about all of this that I just presented, what could be our role as these outsiders? Why would we even be there? Okay, so one thing that's happening, actually, maybe I can put this. This is way too much information, and I wasn't actually going to present it. But what we're hearing in the narratives and what we're getting from the people at the regional level and at the local level is very, very interesting. We have, on the one hand, an understanding that, well, we need health and social services. And I don't know if you know, but Inuit are probably the group, the communities that have the lowest education and the highest dropout rates. So we have very, very, very few people who actually finish high school, let alone go to university, and therefore they don't have the credentials to get some of the jobs that are within these systems. So one super beautiful example I find is the new act on professions. So there's certain professions like social work, psychoeducation, psychology, where you have to have at least a master's or a PhD level to be able to do certain actions. And already there's this incredible difficult situation where they're not able to attract people from the south to come up north, but we're not able to get Inuit people to take on these jobs because they don't have the education that they need to have the status. So you have these people who have these credentials that will come into the system. And so one of the frustrations is that, yes, we need all of these services. At the same time, we're not capable of providing the services. There's an internal, very often internal belief that they're not able to. I think that because of the oppression, there's such a long history of being told that they can't be part of that system. But there's also frustrations with the language. So it's not necessarily, it's not in their language. It can be in English, but not always. And you also often have Francophone people who are less at ease speaking in English. And what else you have? There's the hierarchy within the system. So necessarily, depending on your education, you'll have a certain status within the system, and you might have a better salary or lower salary. And there's this very interesting phenomenon where for people from the south who go work up north, you get benefits. So you have, for example, housing, you get traveling, and not all positions, Inuit positions, will be getting all these benefits. So there's a certain inequality, which is a structural inequality, and it's logistically very, very complex. It's not anybody's particular fault, but it just ends up maintaining these inequalities. So there's a need for the services, but there's also a frustration with the services. On the other hand, at the same time, through the same people, you'll be hearing, well, we want to find our own solutions. When something doesn't work, if a machine breaks, we just throw it out. We don't continuously try and repair it. And so some of the solutions are, for example, going on the land, finding community solutions, finding community resources. But at the same time, they're saying, well, yeah, but there's no funding for that. They're not permanent solutions because we know that they're going to disappear at any time. And sometimes there's a re-questioning, well, is it really going to help? If we send youth on the land and it's going to cost thousands and thousands of dollars, is it really going to reduce rates of suicide, for example? So there's at the same time, can you see on both sides a desire and a need, but at the same time, like, I'm not sure it's actually going to work, and so there's a frustration. And so the emerging solution that, as we mentioned, is coming out from the partnership committee is say, well, how can we bring all the organizations together and give more power at the local level, so that the local level, they can determine what they want for themselves. And you can imagine what would be some of the difficulties. Who's going to finance this? Like, does Canada have any money for community? A little bit, but not too much. So financing is a huge issue, and we're going to see a few other difficulties, but this is the idea. Creating community mobilization supported by organizations and linking with external resources. If I go back to my question before, what is the role of the researcher or the outsider? One of the roles, as you mentioned, I think is very important. We were asked as researchers to document the process, to be able to have some form of a report or something that can say to other communities, well, what do you think you guys could be doing that's similar, but mostly to be able to go and get some funds somewhere with the right wording. So again, it's this question of status and validity, and because I studied a certain way, or because then what I'm going to say might be true. So we're in between, like you're saying, it's constant negotiation. Yeah, it's very uncomfortable. It's very difficult because it's very complex, because if you're not using the right words or the right methods, or for example, you're saying the smiley face system, then you can be seen as not credible, and then what's your purpose of being there in the first place? But if you are too much into using validated and gold standard ways, then it's not going to be valid anyways, and you're not even going to be able to enter into the community. So it's a very difficult position. I think in this instrumental component is very, very interesting. So it might explain the reason why we might enter within a project, but it will never explain the reason why you stay within the project. Because if you are there for an instrumental purpose, it's going to flop 100%. And so I think for the beginning, I was invited because I was a researcher and because I was able to go get some grants and have certain linkages. But if I remained the researcher, I would never get the information that I needed. I would never stay within the project. I would never be here today, because I think the reason why we stay is because of the relationships, the person that we are. So this is kind of the process we went through. We started last summer with a board. We had a really wonderful workshop where we went through what is their vision of where they want to be in 10 years, if we keep in mind how do we reduce singlements and placements under youth protection. And you can't see very, very well, but we had groups that were doing these collages and were able to speak about it afterwards. So this is an example of we can talk of an empowerment method. So it's your idea, it's your process, you use whatever is there, and then you discuss what you want. And what came out in the 3 is the importance of, a family house, which is in the middle of the community. This is in Nukshuk. And then around this family house, or the culture of this center of belonging, you have different services and systems. You can't see very well, but here's actually a plane. So they say, well, we need people to come from outside and to drop by sometimes. But it's outside coming in, and we have a place where we're centralized and we're the ones who are kind of determining how things work. The other elements that were very, very interesting, we had this notion, or I guess a value of the bountiful blessings, which came back a few times. And they were saying, well, we want to feel blessed for everything that we already have. We don't want to necessarily add on new things. We just want to live differently in the way that we're living today. So we want to create greater links, greater partnerships, trust. We want to be able to be there for each other. We want to have a hub. So I don't know if you know, but in Nunavik, like in many regions, the housing situation is just horrid. So they literally don't have any social gathering areas, depending on which community. Some might have, some don't. But just having a space to come together and do activities is almost impossible. So having an area that's their own, that they can determine what's happening there, and that they can call upon people when necessary. And this space, if we think back to the interactionism that I was talking about before, would be a new way of interacting together. So new laws, new expectations. So we're going to, I'm going to trust you, you're going to trust me, we're going to share, we're going to be at equal grounds. As compared to the way that they might describe social services, for example, or the health system, where a professional comes and provides you something and you go away and take it. So can you see the very, very basic difference, but it's fundamental, and it's hard for a professional to understand sometimes that difference, because as professionals we want to be helping. But what I understand more and more is that help is actually understood as being more important when it's in equal grounds. So reciprocity, sharing, which is not necessarily possible within the current systems. So the idea would be to be able to appropriate a way of being, institutionalize it. By institutionalize, I just mean crystallize it, and then after that, relink with everything else and use the resources, but in a different way. That's quite clear, I think, eh? Yeah, it's really this idea of, when you're talking about empowerment, it's not just having a voice, it's also being heard. And so one superb example is we went to a community center so that they would have an idea of how community centers can work in general. And one person asked, what do you generally do? What is the biggest mandate that you have? And the center said, well, something that we feel very strongly about is advocating for families and going to court, for example, and talking to the judges and telling them what we think that the family needs most. And so one of the members of the board said, how come the judge listens to you? And the person replied, well, we're professionals, we're doctors, we're lawyers. And it's a moment where it became just like, wow, it's nobody's fault, but there's this automatic context where if you don't have certain statuses, you're not allowed to write an evaluation of a child saying that they should really stay in this kind of context and get this kind of services. No, it has to be stamped by someone who has a PhD or someone who's a lawyer, okay? So it's being able to change that system where you can say, well, we think we have an idea of how we want to do things. We want to do things a little bit differently, but we still want to link up with the other services. There's a set of values that were described, right? They're there, and you'll be getting the slides. This is the action plan that we started developing last year. I don't want to show you the details, but it's just to show you that we did do it, and so we're going through all the steps. But we have the values, the visions at the end, and then we have the long-term goals, medium goals, short-term objectives and actions, and then the very, very immediate objectives and actions that were going to take place. Do you have any questions about the process? Well, that's a part that I'm going to get at like almost immediately. And it's a very important question, and it's been our question from the very beginning. When do we include those different services? And they're there in a certain way. But as soon as you include those services, how is it going to influence the actual vision that's going to be there at the end? Who, for example, if you have, and it's a very interesting phenomenon, I mean, if you have a group of Inuit people who are there with a few, 2 or 3 people from the outside, it can really change what's going to come out of the discussion. There's a lot of people who are not going to want to speak or not going to feel comfortable speaking. They're going to be worried about being judged, or they might have to speak in another English or French and then it comes out differently. And so do we need them right there at the beginning? And a lot of people were saying they have to be there from the beginning. But what impact might it have on the actual empowerment process? And if they're not there at the beginning, are they going to feel excluded and not be part of it and not understand it and not want to become part of it later on? So it's actually a very, very important question that I don't really have an answer to, but that the rest of the presentation might be able to help us think, at least. Once we set up this advisory board, there was, as I mentioned, there was the core agent within the community. There was a core group that was formed with people from different services that were supposed to meet every month. There were different actions that were held during the past year. Actually, there's a lot of things that have happened. So Kim was present. There was a community feast or activity that took place. There was a logo contest for this family house center. There's a name contest. There's various meetings that were held, and there's a lot of research activities that were taking place at the same time. We were able to do interviews with different people in the community, both community representatives, but also service providers. And we're kind of putting it all together. They're actually right now currently having a workshop, and I'm thinking about it all the time and wondering how it's going to go. But apparently they're present, they're there right now, and it's actually somebody from the Ganawage Diabetes Prevention Project that was here. So Alex McCumber, who's part of that program, is currently there in the community as we speak. Hopefully they're doing well. And so during the whole process, one of the things that I was doing as a researcher was constantly calling people and asking them how are things going, trying to be like a support person, and documenting everything. So all my own reflections, but everything that they were saying to me, all the emails that we were keeping, and just seeing what emerged from our logs. So these are some of the obstacles that we were seeing, and I've gone through the obstacles with the different people who are involved. And just last week we had a meeting with the regional level and went through all these, and they were able to validate and say, well, we really see that in a lot of contexts. Okay, so it's a process that really quickly became highly emotional and relational. There's this phrase is a perfect phrase that everyone has re-said multiple times. We feel like we're walking on eggshells all the time. So as much I myself have said that, the NGOs have said it, the community people have said it, we constantly feel like something's fragile and it's going to break at any time. There's this question that I've seen from the beginning until now, and it's been a couple of years now in this process, where it's never clear who's in, who's out, who's part of something, who's not part of something. And it's actually a question that comes back all the time from our funders, is like, whose project is this? Who's organizing it? Who's acting? And we're always stuck because we never know exactly who it is. There's always a movement, and you'll see a little bit later. It creates this impossibility in decision making, very, very difficult to take action. There's a lot of blaming and negativity. I'll put it later on in a kind of diagram so it'll be easier to understand. Difficult to change perspectives. So one thing that we were seeing in interviews is that there's constantly a blame on individuals or on themselves. And even when we became part of the project, I don't think this is propre aux Inuit, not at all. I think it's part of community mobilization and change, is that even ourselves, very quickly we start blaming, oh, it must have been because she didn't do that, or he didn't do this, or because we're not getting funding from this, or they didn't get the project. And it becomes difficult to get outside of that blaming. There's a huge protection of the project. I'm part of those people who protect way too much, and you have to always be careful. I guess when you're part of a project, you want it to go well, but you also don't want to become paternalistic. There's something very interesting. It was very uncomfortable meetings. And this is something that I find very important, is that when we were working with Inuit about just health and well-being and how do we interact that in a way that makes sense. And I hear constantly the way that we want to interact is by doing something. We want to, not the way that we're interacting right now. So normally what we should be doing is sitting around a table and have beads and have leather and have stuff to do, and we exchange. But in reality, that's not how it's taking place. The meetings are around a table, we have a little paper and a little pencil, and somebody talks, people listen, and then somebody else talks and people listen, and then it becomes super boring, and you just don't want to go to the meetings anymore. And this is not necessarily because there are outsiders involved, it's because that's the way you're supposed to do things, right? Organizations have always done it that way, so why would you not do it that way? So this is something that we started to change, and it just becomes very difficult to work together. It also, all of the data collection and the analysis allowed us to see, yes, there's historical trauma, and this is something that we read in all literature, and as researchers, we're, I think, very, very aware of it. But in the interviews, what we were seeing is that this was not coming out. I think there are a lot of Aboriginal communities that have talked a lot about historical trauma and have gone through a certain healing process that have allowed them to understand how historical trauma impacts daily lives. But in the North, maybe because it's so far and maybe because it's been so recent, there's really very little discussion of the historical trauma, and maybe not even complete consciousness of how it has impacted their daily lives. There's an immense amount of current oppression, as Arlene was discussing. So the example that I gave you earlier on was just how it's difficult to have a voice within certain systems. So thank you for mentioning that. So I'm not sure exactly how it works in the different communities, but as you say, I think for me, this has been essential for me to stop my own blaming. Mm-hmm. So it helps me to say, okay, things are not going right. This person's just never acting. Okay, but why? And then bringing back all that literature and understanding where it's coming from, and then being able to just say, well, it's okay, you know, and we can move forward. So it has helped me a lot. And it's something that through this workshop that they're having right now this week, they're trying to integrate as well so that the people can understand it themselves and use it to understand other people's behaviors. But there's also all of these resources. Remember when we talked about empowerment, you need to have resources to be able to act on with the power that you do have as an individual. And so the lack of housing is a humongous problem. I can't start mentioning to what degree, but like, for example, again, if we talk about youth protection, so a lot of people will take on children under care because they really do care and they want to help. But they're living in these small houses. There may be 10 people living together in 2 rooms or 1 room. And like I'm thinking about a few families, there were like 10 people together. And because when you're going to take someone from youth protection, the kids have to have a room. So the children of youth protection were in 1 room, and then the rest of the family was sharing the living room. And the reason why they had to have the children under foster care is because they didn't have any other source of income. And so they really needed to take these foster children in. So the structural barriers are immense on a day-to-day basis. And so you have people who are not sleeping, who have children who are in these rooms, but who really have huge behavioral difficulties and are not getting support. And so how can they, the next day, act in community mobilization? If you haven't slept, like if you have kids, you know about this, but if you don't sleep and you don't eat very well, there's a good chance that the next day you're not going to be very efficient. And just the current social narratives that are also incredibly oppressing, and the collateral violence, so it comes in here. But the number of times that I have gone up myself and people ask me, what are you doing there, and explain the project, and then they say, well, good luck, or it's never going to happen. And unfortunately, the longer you work in the process, the more cynical you can become as well. So it's very important to sometimes back out and just like take a step and reflect. But this has made people who are working in the project think things like, well, maybe we should just give the money to another community because I don't think we can do it ourselves. Because the amount of pressure on starting a project that's supposed to be empowering is very, very, very intense for people. Because there's an expectation all of a sudden. There's a vision. We developed a vision. Now we have to make sure we're going to get there. But if we don't have the resources, or if we have certain resources and have never really been able to use them before, how do we know for sure it's going to work in a context where we've had years of all kinds of projects that have collapsed? Okay. So this is very, very briefly the how everything's linked together. But you have historical trauma, oppression, bad experiences, and so it leads to certain mistrust. So if you've had lots of people come in, try things, it doesn't work, you're already not trusting, right? The mistrust leads to blaming of others. which then leads to a certain rupture in boundaries of who's within and who's outside. So if you have a group of people, and within this group of people there's blaming, then necessarily there's going to be rupture within the system, and then this what is the inside and what is the outside, and it's not clear. So then who's going to make the actions? Nobody. Or some people, but then they get blamed for it. And then there's non-efficacy of the actual project, which leads to negative outcomes, and then again feeds back to the mistrust. So it's this negative cycle that can take place. When you have systems with no clear boundaries, it looks a little bit like this, where everyone is a little bit everywhere. And you can try and put together like a certain system. So we'll say this is the advisory board, for example, or this is the community. And because there's no clear function within, so for any system, you need rules, you need expectations, you need to have a way of working or functioning that that you're used to. And if you don't have that, then all of a sudden people are going to be floating all over the place. You're going to be, this person's going to talk to this person and say, oh my God, this person really is not doing a good job. And all of a sudden, well, we feel like we belong, right? Because Arlene and I, we can chit chat and be like, you know, you guys suck, and we're friends, we belong to each other. All of a sudden we have a system, but then it broke the rest of the system. Do you guys follow me? And then not only that, but then she's going to say, well, if she's talking negatively about those people, maybe she talks negatively about me, and then there's mistrust. But why are we doing this? Why am I linking with her and saying negative things about other people?
Collateral violence?
There's collateral violence would be one very important thing that's happening. I also think, and this is something that I experienced very recently, I realized, I'll say it after, but it creates temporarily a sense of belonging. This might not be the reason, and maybe this is completely crazy, but for a moment, we're connecting, right? We're connecting on somebody who's outside of us. And so I think it allows for basic needs, and we were saying before, if you want certain empowerment, you need to belong to something. You need to feel like you matter to someone. And then so that's one way of doing things that works. We could do it in multiple other ways. We can connect in multiple other fashions. But as you said, I think collateral violence is something that historically has been passed down through various systems. And also because if we know that so many things have not worked in the past, then if I'm going out there and saying, hey, you know, everyone's doing a good job and this project's going to work, then you're putting out there all of your hope, which most likely is going to be smashed. Does everyone understand what I mean? And I'm not saying all this because I want to take all the hope out of you guys, but it's just because I think it's so important to understand, to give meaning to all this that's taking place so that we can move forward and just not get drained out of. So very, very recently, and I've been thinking a lot about the role of the outsider and the insider, and if you are interested, I mean, there's really a lot of articles that are out there on the inside-outsider. Merton is a really good article. Later on, we can talk a little bit of Simel's or the concept of the stranger, but the times where things were going really, really well is when, for example, Kim was in the community, when we had the workshops, when I was able to go and to do various interviews. When there was someone from the outside who's trusted, and it takes time to get that trust, but who's still from the outside, then all of a sudden, all of these people become the inside, and they can regroup around something because I'm the outsider. Do you understand what I mean? Mm-hmm. And so it happened a few times recently in the project where there's a couple of people with who we're having a bit more difficulty, or I'm having difficulty, or they have whatever. But and then when all of a sudden there was someone from the outside that came, we became like best friends. And like, wait a minute, how did that happen? It's because all of a sudden we have something that's ours that we can tell people about. So if we're thinking as researchers, can we be that body that can be not only a listener, well, I think in just being a listener and being an observer, there can be a potential for creating a sense of belonging, because I'm not part of it. Can you guys tell me about it so that I can learn more about it? And then all of a sudden, all these people are the experts, and it's their project. They belong to something. Exactly. I think it's, and that's what you were mentioning, this notion of space. It's setting a safe space, so setting clear guidelines, like transparent rules, regulations, and physical space. And this has been the importance of also the family house, just like having a physical location that can be safe, where all of this can happen and you can regroup and be a system. Well, again, it's this idea of there's a safety net, but there's like a boundary.
Yeah.
The importance of boundary in systems is very, very interesting and very important. And if you think, as Arlene was saying, is that all the ruptures that have taken place over the past hundreds of years, there's what culture can be one of those boundaries. And in transcultural psychiatry, there's a lot of work. So Tabinatans, for example, their group, they'll use culture, traditional culture, as a set of guidelines or boundaries to be able to hold a group, so that once they're held somewhere, then the group can start working at their own set of boundaries, own rules or expectations. And so that can be something that any outsider, a researcher or a clinician could potentially do. However, what would be some of the risks? That you have the whole concept of permeable and impermeable boundaries. Mm-hmm. So you can have impermeable boundaries where you're clearly external to the outside and pretending that the outside doesn't influence the inside. And then you have the whole notion of the open systems. Bertalanffy, for example, who will discuss how the external will influence the internal, and that there's a certain permeability at the boundaries, and it's always kind of changing, always moving. But that's an important point, is that for me, I've felt that I maybe started there, but right now it's not at all clear that I'm out there, and that's a huge risk. So there's a couple of huge risks, is that if this person has perceived power, there can be mistrust, but this person is also often belonging to an organization that has their own set of expectations. So all of a sudden, this person also needs certain things and can highly influence what's going to be happening inside here. So then, does it become this person's project or these people's project? It's a slippery slope, and this person can very quickly become an insider. And that's why it's interesting to read the text by Merton that I was discussing earlier. There's a lot of research that looks at the sociology of research. When is it important to be an outsider? When is it important to be an insider? If you're not there as an insider and you don't have the relationships, you're not going to be staying, and you're not going to be getting what you need as information, or you won't be helping the way you need to be helping. And but you might not be getting all the objectivity that you need to be having. And so in various articles, they'll talk about the importance of going back and forth, inside, outside. More recently, what I feel personally is the importance of layers. So in this project, what we're doing is that I and my students are very much inside, because we're very much part of the project in many ways. But we have an outside layer. Arlene is one of the outside layers. You didn't know that, did you? And so Georges Racas is another person, Fabienne Lagueux. So these people from the outside who can look at us and kind of reflect on how things are going and give an outside perspective. This is another very important concept, and it comes to what you were mentioning before. So the importance of having people at the outside level, the institutions come inside to be able to listen to what's going on. So there's this is in capacity building. We talk about 3 levels of capacity building, or 3 layers that need to be done. So there's bonding, bridging, and linkage. Bonding is when we talk about all the links within the community. Bridging is links with other communities, and linkage is links with institutions and services and everything that's outside. And in our project, what was happening is that, like, immediately people would hear about the project, and they would want to become partners. They'd be interesting, they're active, they're like, we're there. So we started having in this outside layer a humongous number of people or groups that would want to be part of the project. At the bridging level, it was a lot more difficult. So we only have one or two communities they're there, they're hearing, and they're interested, but it's more difficult to link logistically. And at the bonding level, there's a lot of stuff that that's trying to be done through this core group, for example, a lot of meetings. So people are there, but the actual working together and mobilization is a lot more difficult. And one thing that happened just very, very recently as we were preparing the workshop, and then all of a sudden, it's been months that we were trying to get things to work, and then all of a sudden we have, okay, a date is possible, and all these external organizations are ready, and we're ready to go into the community, and we're ready to listen, but then people in the community weren't even aware that it was going to happen yet. There was not even they didn't know about the date, they weren't invited yet, and then it just became like, okay, this is a moment we have to stop and think, how is that impacting the project itself? You have all these organizations that already have sets of rules and regulations and expectations and ways of functioning, and they have funding, and it's part of your job, so you just go and you act, and you have to report back. So it's like the action is already, it makes sense, it's easy. And then we're asking people at the local level to make it their own project, but they're not getting paid for the project. It's for a project that's not under someone's mandate or job or institution. They don't even have a local place to meet. They don't have, there is funding available, but it's difficult to understand who can use it for what reasons. And then they're having all these outside people saying, we're there to help you. And so it's with a lot of really, really, really good intentions, but how can that be disempowering at the same time as empowering or wanting to be empowering? To understand it better, I've been reading a lot on this community readiness model, very, very interesting. And there's the community operational research. If you type a little bit to check, there's a really good work on community operational research, the ARC model, and they better explain community readiness. I think I'm going to start with, this slide a little bit lower. So this is the inside of the big circle. But what they'll suggest is that you have capacity building is your end goal. But to get to that end goal, you need to have a set of characteristics. So you have work, for example, by Lockhart, Mignoni, that will show that to be able to develop projects, you need to have a certain amount of political efficacy, social vitality, and economic viability. You have to have a certain amount of leadership. You have to have certain things that are there to start. That's going to be able to feed into the functioning of the project, the group's feeling of effectiveness, and finally, positive outcome. And then this positive outcome is going to feed back and give, enhance the characteristics that are there for community readiness for another project, okay? But what happens in a context where you have very, very low political efficacy, social vitality, and economic viability? What do you do? If we don't have everything that we need to have the project functioning with fluidity, and we don't have group effectiveness and we don't have positive outcome, then it feeds back negative loop to have even lower characteristics that are necessary for community readiness. So as the outside person, I guess there's multiple ways of seeing this. How would you react? What do you think would be a way to work with this model? Have any of you, with working in communities, felt like a moment where just you feel like it's not moving forward? The wall, the invisible wall? Yeah? Okay. One part that I felt very, very touchy, very difficult. If you want things to go forward, I think personally, I might be completely wrong, but I think that there needs to be a certain amount of positivity. There has to be positive outcomes. But what if people are not, at the current moment, completely capable of getting the outcomes that they want? Would it be possible to kind of insert positive outcomes? That's something that we've been trying to do. So one of the things that we tried to do a couple of times, we sent out care packages with like drawings of family stuff that we've been doing. One thing that we've been working on is a newsletter, but we never say that we're the ones doing the newsletter. So we're kind of acting as the invisible hand, which is probably not that good, but we're getting, the partners all agree with it. So we have this newsletter, which hopefully will become the community's newsletter, and we've been having these actions. So for example, getting the school involved, getting people at the community level involved to help with the newsletter. But it's a way of just like inserting something positive that people can feel very good about. The organizations that we've been working with have seen these difficulties and have chosen to stretch the boundaries of their own limitations. Normally, so the financial pockets that they have. So for example, they're not necessarily able to pay for a building, but in this case, they realize that, okay, if we don't help renovate a building, nothing's going to move forward. So the different organizations, the different people involved have tried as much as possible to just kind of infuse some positivity to be able to feed back into the community readiness. But again, that's very, very, very touchy, because it can become, you can be inserting the wrong stuff. It can easily be viewed as the outsider's project. So keeping that balance between ensuring that it's the community's project, but also ensuring positivity is very, very, very complex. It's a slippery ground. I think we also have to be careful, and we can listen to some of your experiences as well. In this slide, I just wanted to, I think I heard it a little bit in Arlene's discussion and what you were saying as well in the questions, but this seems to be the process that we're experiencing, is that you have objective, and then you have a group of people who will have a lot of passion. There's one reason to be doing these things, because you're very, very passionate about it and you believe in it. And there's interesting theories of double bind that suggest that when there's a double bind, damned if you do, damned if you don't, the direction that you're going to go in is going to become more and more repelling, and the direction that you're going away from will become more and more attractive. Okay, so here's exiting or abandoning, and here we have the objective. So you say, okay, I have this idea, we're going to work together, we're going to do this action, we're going to like have these values, visions, objectives. We start moving towards the action. All of a sudden, there's all these obstacles that are in our way. Certain negativity, blaming, problems with location, whatever. And then the closer you get to the objectives, the more frustration and disqualification you're experiencing, the more attractive the exiting strategy is. And so all of a sudden, you're not going to actually get to the objectives. You're starting to return backwards, and you're going to distance yourself. And this we were seeing systematically with everyone who's involved in the project. There's these moments where they're not going to be answering their cell phone or their emails anymore. They're going to go on holidays, or they're going to just like disappear because they can't deal with it anymore. And so it goes, but then, so as you get further and further, there's a danger zone, because you could potentially exit. But there's also potentially other positive things that happen. As I said, this will become more and more attractive because you're leaving it. You distance yourself, and then all of a sudden you remember the hope that you have, and you remember the reason why you're there, and the values that were there, and the relationships that are there, and then all of a sudden something positive happens, and then you start going back closer to the objectives. And it's a back and forth process, oscillating. And if we link back to this idea of inside, outside, I think it's also taking place, where you can start going inside, and then all of a sudden go outside, and inside and outside. And I think that is a process that not only the outsiders, the non-Aboriginal are experiencing, but also the Inuit that are working in the project will also become outsiders. Okay, so there's always this movement of going back and forth, which is necessary and potentially empowering for the individual, but can be very, very, very complex for the actual project. Because if people are always exiting, coming back, then how do you actually ensure fluidity and continuity in the project? Okay, and that is where I think of the importance of having the multiple layers. So you have to make sure that you always have not only one individual or two individuals or one person for each organization that's holding the project. You need to make sure that that person is held by another layer and held by another layer, so that you're constantly yourself able to go back to another layer to talk about things, reflect, and then come back in. Okay. Is that something that you've experienced yourself within the communities when you've been working? Exactly. I think that's been one of the very fascinating processes that I've experienced throughout this project, is just the number of things that you need to know. You can be trained in whatever background, you're not going to have enough. And at one point I was just saying, I need an organizational psychologist to be here right now, and I need to figure out what are the links between who. And it's not, I don't know that stuff. I'm not an expert in that. I'll never believe that I am. But you're right. I think there's a part where we need to know about psychology, psychiatry, about organizational research, about community mobilization, about so many different hats, about culture, about anthropology, sociology. There's so many things that's why we need to have lots of people involved, lots of resource people. And yes, the conflict management part is something that I have yet to resolve and understand. But I think there's organizational studies, organizational psychology can help. But there's also a lot that has to do with just anthropology and sociology and how does each culture manage conflict? How has conflict been managed traditionally? How has it been warped by historical trauma? And how is it experienced today? They're very, very, very complex questions. Yeah. It's a nice example. And I think it's, again, I mean, it's not that it's somebody's fault or it's, the government's fault, or there's policies or structures in place that you have to abide to certain functioning, and then the closer you get to that, the more difficult, like you're saying, the bottom up approach is very, very important, but it's going to go nowhere if you're not doing the up policy change as well. So we were working on this paper, Ethics of Eliciting Dreams, and the idea behind it was just, okay, well, it's very important. I think it's impossible to move forward if you don't have a common vision, you don't have values that are looked at. But what are the disempowering actions in eliciting visions? When you ask for someone to think about their dreams and to plan around those dreams, what are some of the things that can happen that are disempowering? So, Arlene, when you were giving the example earlier of a 5 versus a 10, and somebody who will say, well, I want a 10, so someone's going to say, well, I'm okay with the 5. We could say, well, why are you okay with the 5? Like, how could you think that way? And I've been realizing how lucky we are living in where we are. We can dream things that most people can't dream. And for us, anything is possible. Like, if I want to become prime minister, I'll become prime minister. But that's not something that most people in the world are allowed or able to do. And so when you say, well, okay, well, dream big, get your 10, but the 10's not possible, then there's a whole ethical question behind that. It's like, how far can I encourage people to dream when that dream is going to be very, very, very difficult to attain? Not everyone has the same resources and ability or experiences around dreaming. And not everyone has the same power of action, so the same ability to really make that vision something that's possible. So I think it doesn't mean that we shouldn't be asking people to develop their ideas or their dreams, but it's something we should be very conscious of when that dream is not what we would have expected it to be, or if it's very difficult to attain that dream. We can't be in the judgment mode. We have to understand it as being part of a whole history of experiences, of negative experiences. And I thank you for that comment, because it's something that I think I've been dealing with time, is that when I started off, I definitely didn't see any of the obstacles. I was completely naive. I saw the obstacles in the literature, but then you see what you have to do. You have this model, and you'll do community-based participatory research, and you'll have an empowerment model, and it will work. And then you start seeing the obstacles, and the longer you get, and we were saying before, the longer you're part of something, the more cynical you can become. But that is incredibly dangerous. So I have people, for example, like Kim is one of my students, and other students will come in and say, well, let's do this and let's do that. And I'm like, it's not going to work, But then that's what I was receiving when I was saying to people, come on, let's try this, let's try that. And they were saying it's good luck. And so it can become very, very disempowering as well, if, for anyone who wants to take action, if you're being very, very negative. But if you're not conscious of those obstacles, then we're just redoing the same thing over and over and over again. So it's how can we be conscious of the obstacles, but not cynical and negative and like burnt down by them? Hence this back and forth, the distancing, which is necessary, I think, so that we can at some point just say, okay, you know, and then start again. Like take off the negativity and start again. And that's why the importance of, as researchers, the luckiness that we have of reading articles and understanding all of this, so I can say, well, it's not the project's fault, or it's not the people's fault. It's all this context of historical trauma, of current oppression, of systems that are going against the things that we want to do. And so that really, really helps myself. I don't know if it helps other people, but it helps me just see things in a less negative light and be ready to continue. And because I have to say, and I haven't said this since the beginning, there's a lot of nice things that are happening in this project. Like in the past year, we've had a group come together, a common vision at both the regional and the local level, and people outside. We've had organizations ready to fund it. We have a house that right now, I'm getting goosebumps, I'm all excited, but a year ago we didn't think we were going to have, and right now is being renovated. We didn't even think we'd have funds, but it's being renovated. We have the school involved, the daycare involved. We have the newsletter going out. We have the community logo for the project. They chose the name. They had a community radio event, so every week they would go on the radio and speak about the project. And we have links with every single big organization or institution at the regional level, which is huge. I mean, you have the directors of every single institution who are saying this is our priority and we're going to work on that despite all the obstacles that are there. So, I mean, there's a tremendous amount of positivity that we always have to remind ourselves, and that we have to write down and evaluate because it's there and it's important. It's going to be our hope to move forward. So actually, there's one little comment I wanted to make for one of the questions, and it made me think about this right now, the link between policy and or funding. And one of the difficulties of having some kind of an empowerment project is that necessarily it's not going to be, you can't plan ahead. You can plan the steps, but you have no idea where you're going. You don't know what the outcome is going to be. So how do you explain that to funders and to service providers or to a policy level? And that's one of the big things that we've been, like just last week again, and I've been hearing it a lot. What's the plan? How many people do you need? How much is it going to cost? And I don't think you have any other option to say, well, I don't know. And in a context where our systems are, I mean, we can't deny that we're in a neoliberal context, and where we need productivity, we need efficiency, we need, to ensure cost effectiveness. Well, when we're proposing, let's sit together and figure out what we're going to do. Can you give us money, please? It doesn't really fit in the model. So how to write out certain things in a certain way and without lying, saying something that's going to be attractive and understandable to policy level, all the meanwhile being truthful and flexible at the community level is a challenge, a humongous challenge. I'd like to hear you guys more. So I think that the end part was just like, what is the R in community-based participatory research? But but I think we've talked a lot about this. So what is the role of the researcher? Some changes that we personally have made within our project is, this is something I haven't had a lot of time to talk about, but if you talk about empowerment and you talk about change, where are you expecting the change? If you're expecting the change to take place at the community level, and we're there to observe the change or to participate and to help in the change, then again, you are the outsiders expecting change in the inside level. And if it's not happening there, then you're thinking, well, why is it not happening? It's frustrating. And at one point, this is incredibly personal, but I think it's important to say it anyways. We're working on community family house and bringing families together, and I was going back and forth and working on this project, and it's all these different obstacles, and then coming home to my own family, which is as dysfunctional as anyone else's family, as wonderful, but also as dysfunctional. And then at one point I'm like, oh my God, we're here to evaluate families and to bring them together. Is my own family together? And so that's when we started as a research group saying, okay, we have to rethink things. Can we see, instead of seeing over there as being this target of change, can we be a target of change as well? And can we assess ourselves or view ourselves as, for the analysis as well, to understand certain processes which are not Aboriginal processes, they're human processes that are taking place in an Aboriginal context of marginalization and oppression, okay? So how can we understand those processes to help human beings, including ourselves? And I think that, in a way, can be healthy because it can allow, it takes away a certain pressure from the group that you're asking to change. And it allows you also to be at a certain power equality, because you're saying, well, I myself have to change. I have to do certain things, just as you are wanting yourself to do certain things. So it's putting ourselves in a risky social, emotional terrain. We talked about this, the multiple layers of insiders, outsiders, and participating in this idea, which I would like to hear you on, is participating in creating small change, but only temporarily. And those are some of the things that we were looking at for actions to be taken for the different obstacles that are. Of that, ensuring consistency, rituals, safety, and positivity. So if you can use the models of complex trauma. There's the ARC model. There's two ARC models that I know of. There's a complex trauma model, and there's one that's the availability, responsiveness, and continuity. But if we understand a lot of the organizational difficulties as being part of a history of trauma, how can we use what we know about intervening in trauma to better work together? So how can we ensure continuity, consistency, the expectations are there, so we can build a certain amount of trust, that rituals are used to be able to start and end any meeting, and just in the number of times that we'll have meetings, the intervals between meetings, who is invited to meetings. So creating that, the skin that you mentioned, creating that boundary, or the rules within the system. So that's the part that I wanted to give. I think we have about 10 minutes left, so I'd really like to hear you, and you can even tell me what you think, what we should be doing for our project. Like, have you seen any slips that we've been making that you think that we should be informed of? It's something I think somebody mentioned with the culture of research before, and I think depending on what cultural research culture you're from, I mean, I think in anthropology and in sociology there might be a little bit more space for reflexivity and autobiographical ethnography, for example. Like, that's something that I would never have imagined as actual research, because I was trained in epidemiology, and so you're supposed to do like quantitative stuff, and you have to be very objective. So it was very frightening for me to start looking at myself, not just because looking at yourself is difficult, but also because if I start looking at myself, are my colleagues going to think that I'm crazy and I'm not a real researcher? So sometimes you don't show everything that you're doing, and you think about how you're going to present things depending on who the audience is. Mm-hmm. But I think it's changing the culture of research as well. Like you're saying, the gold standard is wonderful for a certain context, but I mean, it's completely useless in multiple contexts, and how to get that message across is very difficult.
And still keep your job.
And to keep your job, and to get those publications, and that's something that you can say that you're there to help for community mobilization, but if I want to be there to help for community mobilization, I need my job, so I need to publish, and therefore I need to be writing what you guys are saying, and I have to come and talk to people about it and disseminate it, or else I lose my job, you know. So there's certain like structural components that are there no matter what your intentions are. That's there's 2 points in there that I find very important, is like how can, with our community and with our interactions with Aboriginal people, how can we learn from that to be able to change everything. I remember at the PhD level when we were looking at funding organizations, for example, and you always have to find a way to show that you're working on the Aboriginal problems. And it just became clear that it's not Aboriginal problems, it's like social problems that are put onto Aboriginal people, and there are human problems, and how can we learn from those human problems to change a wider level. But the other point that you're mentioning is very interesting, is are certain systems dead? And that's the whole question of institutionalization. So when you institutionalize something, it becomes more crystallized and more difficult to be flexible in movement. And so as much as you want change needs to be institutionalized for it to be there long term. But the danger of it is, as soon as it becomes institutionalized, it can become crystallized and dead. So how to make sure that it remains moving, even if it's stable. The first point, if you have the time and if you're interested by work in the North, there's a really interesting book. I think it's Critical Anthropology of Inuit Studies. There's Lisa Stevenson, who's a co-author on the book. But it's interesting because in the book you have different chapters, different projects, and the importance of relations, of building relationships, and of accepting that that's part of the research is very, very, very interesting. The second point, the one of not having a bad impact, or how did you say it? Not putting people in trouble. I'm sure that this is nothing to do with the type of trouble you're thinking of, but it reminds me always of what is my objective as a researcher. Is my objective to write, to document what's happening, or is my objective to participate in social change and to document the social change? So I could come here today and tell you everything that's objectively happening, but if I do that, is it going to be what's needed to participate in social change? Not necessarily. I think we can say a lot of things that could crystallize, like, for example, the lot of literature on Aboriginal identity and Aboriginal culture, and the risk of crystallizing identity and culture as one thing. And if I just say, well, this is how it is, then we're going to continue with the same problems. Versus if I come here and tell you something different, but it's going to create change, then am I a researcher? I think so, but I'm not a researcher who's there with the objective of objectivity and showing the truth. I'm there, my truth is more in participating in the creation of change. And that brings me, something that's helped me understand it a lot is just reading recently philosophy of knowledge and reality. And so there's classic philosophy or classic understanding of what knowledge is objects or events or things that are there and that you can show or prove that are there. And so that would fit more in a positivist or a post-positivist construction understanding of reality. But more recently, there's been more of a process philosophy of saying, well, no, reality is the changes that take place between those events. So it's not just like something that you can actually see, but it's everything that takes place between those actual events. And that's going to depend on the experiences that people have of it. And so there's process philosophers, Nietzsche who's one of those philosophers, it gives us validity or allows us to do the kind of work that we are doing. So it says it's okay to not study events, but to try and study the change and our own change and our experiences through change. If you guys are interested in this kind of stuff, check out community operational research. Because the words to me mean nothing, I never actually typed them out on Scholar Google, so you don't find them. They have this really good book. It's community operational research. I'm thinking about the author, but anyway, when they open up, they start saying, well, their words don't mean anything, so no one actually finds us anywhere. But when you do find them, you'll find a lot of the understanding the processes, that it's not as easy as expected. So check it out. It's very, very good, rich work there. We're definitely trying to, as much as possible, just by in our interactions, because pretty much with everyone, and I think Kim has experienced the same thing, but because we've become so close with everyone, I mean, I remember at one point where I was having a family situation. The very, very first person I contacted was one of the people that I work with very closely. And so because we're so close, and when we're talking about the project, we always go back and forth, and it's a personal process. So I think they're very, very much aware of how we're experiencing it as individuals. Some people might say because we become friends with the different people that it's not research anymore. I don't know. But at the same time, I think it allows and makes sure that it's a reciprocity, that it goes back and forth. They know what we're experiencing. They know what we're learning. One of the things that we were doing, like I started learning how, and Kim as well is a wonderful bead maker now. She does wonderful earrings. But so these are things that we did, and we decided to have these meetings with a whole lot. We had a beautiful meeting with all these beads and different things that are there on the table to say, well, this is what you have wanted, and we think it's important, and can you show us how to do it? And now we're doing it in our daily basis because we think it's important, and this is what we've learned from it. And so I posted a few things on Facebook, and so it's like we're trying to. I don't want to make it feel as if it's being instrumentalized, because it really isn't. It just happens. And we try, like, these kind of presentations. I had one last week with the regional partners and the different institutions, so they're very much aware of everything that we were experiencing as individuals too. So we hope so.